In 1999, the Prostate Cancer Center was established because there was a need in our community to help those facing prostate cancer. That need has never gone away, and this has been an exceptional year for us as we prepare for the next 25 years of supporting men and their families facing urological disease. Since 1999, we've seen over 200,000 patients. That's through our rapid access clinics, our post-op care, visits to our Man Van program, or through our clinical trials. And as we celebrate this expansion, it's really about what's next for us over the next 25 years. The addition of our mental health program and our prehabilitation programs allow us to take the next step in supporting our mission, saving lives and saving families.
This is the first, and I would say really a world-leading opportunity to build wellness into the cancer care pathway.
Prehabilitation is really something so unique. I describe it often to the public as you wouldn't run a marathon and then train for it afterwards. So why are we going into surgery and then telling people they need to be healthier after the fact? The idea is get people healthier before a surgery.
A lot of times when we think about a physical illness, we just think about the body and the body needing to be treated. But what we know is that for so many people, mental health is actually a really significant component of them physically getting better.
The original idea came from Dr. Kawakami, who really approached the PCC with this idea of creating a prehabilitation program. He observed that the patients who were in better physical shape routinely had better post-operative outcomes. His proposal would ultimately change the way we approach patient care, and the idea could give our patients the confidence to create those better outcomes. Sadly, in 2021, Dr. Kawakami passed away before he could see his vision realized. But thanks to the generous support of our community and donors like you, the Kawakami Prehabilitation Program will be the most comprehensive prehab program in the world, here to ensure we revolutionize the way we deal with patients in the future.
Our research is directly conducted within the Calgary prostate cancer, and I have to say that the patient here can get the most immediate direct benefit from those research.
This prehabilitation pathway is really a focus on wellness and all of those lifestyle behaviors that go with that. Nutrition, physical activity, stress reduction, and for this population, that sexual health component as well.
New programming with Prostate Cancer Center that we're bringing in is part of the support system for patients who are going through the cancer care.
We are conducting this Taiji prehabilitation study, investigating how that can improve patients' not only physical health, but also their mindsets, their mental health.
It's also the families and support systems that benefit from care so that they're better able to support their loved one. The more we're able to prepare people in terms of what's going to happen, the better they're feeling prepared and able to go through the process.
The option of couples therapy.
We've taken some considerations about diversity into account, different sexualities, different gender dynamics, different relationship situations, whether it's non-monogamy or monogamy.
So if folks are feeling like they need a place where they can have some support around communication in terms of what to expect from treatment, how to adapt as a couple after treatment. We are so blessed to have such an incredible new space dedicated to all of these program expansions, designed so that you can kind of hang out here and you can get some support and meet other people. It's not just come in for your appointment and go.
We have an amazing physical environment here that can support them and tailor to meet their needs across all of those wellness behaviors, but we also have the excellent opportunity to move beyond the walls of this building, whether it's one-on-one sessions or group-based classes that they can join from the comfort of wherever they are, really connect with the larger community.
Our goal is to generate evidence-based intervention, which can be incorporated into an evidence-based program. And all those programs will be published in research outlets as well as in conferences where we're developing a logical model of the prehab program so we can disseminate those knowledge nationally, internationally, so they will have a wider impact to the wider patients all over the world.
It's truly incredible to see all of this hard work come to fruition here at the Prostate Cancer Center, and it's really not possible without thanking a few people. First, I have to thank our staff and our volunteers. Their talent, their resiliency, their innovation, and their commitment and passion to our patients and their families each and every day is truly inspiring. I have to thank a couple of our donors too, and I know I won't be able to thank everybody, but a couple of our major donors that really made all of this possible. Rance and Marilyn Fisher and their family foundation. None of this would be possible without them. John DeSanti, Clayton and Linda Whitus, Randy Remington, and the entire team at Remington Development Corporation that really helped us transform this place into a place of wellness on a budget. And then of course I have to go back in time and thank a few people who really saw a need in our community and stepped up with their philanthropy. Brett Wilson, Doc Seaman. This wouldn't have started without your generosity, and of course the vision of Dr. Brian Donnelly, who really got us to where we are today. It's absolutely amazing that 25 years ago we stood there and said, we can do better for men and their families facing prostate cancer, and now we're here. The next 25 years is truly going to be transformational in healthcare, and I'm so proud that the Prostate Cancer Center will be leading that charge.